Good day, ladies and gentlemen. We are the Group 1, and we are going to report NCM 107 RLE Module number 1, entitled Leopold's Maneuver, Anti- and Postnatal Exercises. With group reporters, Miss Samantha Pearl J. Pimentel, Miss Ashley Y. Akop, Miss Rochelle S. Morales, Miss Julia Nicole C. Bihona, Miss Reese Jody E. Ho, and Mr. Jeremy A. Ditchos. With facilitator, Ms. Nikki Ray R. Kayanan, RN. Course Learning Outcome, CLO number 1. Define the key terms of Leopold's maneuver and anti-postnatal exercises. CLO number 2. Discuss the importance of Leopold's maneuver, antepartal and postpartal exercises. CLO number 3. Discuss the maneuver of Leopold's. CLO number 4. List and compare antepartal and postpartal exercises. CLO number 5. Explain the principle involved Leopold's maneuver, ante- and postnatal exercises. CLO number 6. Examine the guidelines in Leopold's maneuver, ante- and postnatal exercises. CLO number 7. List the nursing responsibilities before, during, and after performing Leopold's maneuver, ante- and postnatal exercises. CLO number 8. State comfort position related to antepartal and postpartal exercises. CLO number 9. Document client responses and outcomes after Leopold maneuver and anti-postnatal exercises. Let's start the reporting together with my group mates.
Hello everyone, I am Samantha Pearl J. Pimentel and I will be the first reporter reporting CLO number 1, define the key terms in Leopold's maneuver and anti-postnatal exercises. So the first term is antepartum. This is the time between conception and the onset of labor, usually used to describe the period during which a woman is pregnant. It is defined as bleeding from or into the genital tract occurring from 24 plus weeks of pregnancy and prior to the birth of the baby. Next is antenatal exercise. These exercises are the safest and the most productive activities which can improve blood circulation for the fetus, and it can also help prevent excessive weight gain for the mother. So these activities carry little risk of injury and benefits a pregnant woman's body and can be continued until birth. So examples of these exercises are swimming, brisk walking, indoor stationary cycling, and low impact aerobics. Next is ballottement. This is a sharp upward pushing against the uterine wall with a finger inserted into the vagina for diagnosing pregnancy by feeling the return impact of the displaced fetus. So this is as shown on the picture on the bottom part of the slide. Next is Bartholomew's rule. This calculates the estimated age of gestation of a fetus depending on the height of the fundus. So here, instead of measuring with quantitative methods, we will be using landmarks. So for example, if it's on the symphysis pubis, the age of gestation is about 12 weeks. For the midway between the symphysis pubis and the umbilicus, this is about 16 weeks. For the umbilicus, this is about 20 weeks. And for the xiphoid process, the age of gestation is about 36 weeks. Next is crowning. This is when the baby's head starts to emerge bit by bit during each contraction. So this occurs on the second stage of labor, as shown on the picture. Next is engagement. This is the entrance of the fetal presenting part. Based on the picture, in this case would be the head, and into the superior pelvic strait and the beginning of the descent through the pelvic canal. So this is when the baby's head is even with the ischial spine. So the baby is said to be engaged when the largest part of the head has entered the pelvis. Fetal heart tone or rate. This is usually ranging from 120 to 160 beats per minute. And this is for the in utero period. So this is when the fetus is still inside the mother's womb. So it is measurable sonographically from around 6 weeks. And the normal range can vary during gestation. So it can increase to around 170 beats per minute at 10 weeks, and it can also decrease from then to around 130 beats per minute at the term. Finger breadths. This is a unit of length based on the breadth of a finger. So the breadth of a finger is approximately 3/4 inch or 2 centimeters. So this is as shown on the picture. And this is usually used to measure fundal height. So an example statement for this is, let's say, 3 to 4 finger breadths below the xiphoid process. So this could mean that it is 6 centimeters below the xiphoid process. Next is fundus. The fundus is the top part of the uterus and it is broad and curved. So this is the part which is routinely measured in pregnancy to determine growth rates. Fundal height. This is defined as the distance from the pubic bone to the top of the uterus measured in centimeters. So earlier we discussed Bartholomew's rule, which used the landmarks. So here we are actually using measurements in centimeters. So when it's over the symphysis pubis, that's about 12 weeks. At the umbilicus, that's 20 weeks. And at the xiphoid process, that's 36 weeks. Next is gravida. This refers to the number of times a woman has been pregnant. So nulligravida is a woman who has never been pregnant. Multigravida is a woman who is or has been pregnant for at least a second time. And primigravida is a woman who is pregnant for the first time. Next is Leopold's maneuver. This is a systematic method of observation and palpation that determines the fetal position, fetal presentation, and engagement, which is done as a part of physical examination. So with correct assessment and findings, it can indicate whether the delivery would be complicated or if the mother would need to undergo cesarean delivery. Next is lie. This is the orientation of the long axis of the fetus and the long axis of the mother. So for us to easily understand that, I included a picture on the slide. So for figure A, we have longitudinal lie. This is the situation in which the long axis of the fetus is parallel to that of the mother. Either the head or the breech presents first. So for figure B, we have transverse lie, which is the situation in which the long axis of the fetus is transverse to that of the mother. So the most common of these lies or orientations is the longitudinal lie. This is along with the cephalic and breech presentation. Next is maneuver. This is to carefully guide or manipulate someone or something in order to achieve an end. This could also refer to moving skillfully or carefully. Is para. This refers to the number of successful births of a woman. So the first one is nullipara, which is the term for a woman who has never given birth or carried a pregnancy beyond 20 weeks. Next one is primipara, which has had completed a pregnancy at 20 weeks or greater. And the last one is multipara, who has had 2 or more births beyond 20 weeks. And as a side note, multiples such as twins are only counted as one birth. Next is postpartum. A postpartum period begins immediately after the birth of a child. So this is as the mother's body, including hormone levels and uterus size, returns to a non-pregnant state. Next is position. This is the relationship of the chosen portion of the fetal presenting part in reference to one of the 4 quadrants or transverse diameter of the birth canal. So let us direct our eyes to the picture. So for the right side, we have right occipito-posterior, right occipito-transverse, and right occipito-anterior. We also have left occipito-anterior, left occipito-transverse, and left occipito-posterior. So the most common in labor is actually the left occipito-anterior position, which is found on the picture on the lower right side. So this is when the baby's head is slightly off-center in the pelvis, with the back of the head towards the mother's left thigh. Next term is presentation. This is the fetal body part that enters the maternal pelvis first. So the first one on our list is vertex presentation. This is when the baby is positioned head first, with their occiput entering the birth canal first. This is actually considered the normal way that a baby is positioned for birth. This is also the most common presentation, that is the vertex presentation, and it is associated with the least complications. So any position other than the vertex position is considered abnormal and can make vaginal delivery much more difficult or sometimes even impossible. The next one is shoulder presentation. This is also the baby on transverse lie. So the baby's presenting part is the arm, the shoulder, or the trunk of the baby. Next is brow presentation. A fetus in brow presentation has the chin untucked and the neck is extended slightly backward. As the term brow presentation suggests, the brow or the forehead of the baby is the part that is situated to go through the pelvis first. Next is face presentation. This occurs when the face is the presenting part of the baby. In this position, the baby's neck is deflexed or extended backward so that the back of the baby's head is touching its back. The last one on our list is breech presentation. This occurs when a baby's buttocks or legs are positioned to descend the birth canal first. So, breech positions are dangerous because when vaginal delivery is attempted, a baby is at increased risk for prolapsed umbilical cord, traumatic head injury, spinal cord fracture, fatality, and other serious problems with labor. Next is station. This is how far down the baby's head has descended into the pelvis. This is determined by examining the cervix and locating where the lowest part of the baby is in relation to the pelvis. So there are assigned numbers from -5 to +5 to describe where the baby's presenting part is located. So on the picture, we have -5 for floating, 0 for engaged, and +5 for crowning. The last term is the symphysis pubis. So this is a secondary cartilage joint that is located between the left and the right pubic bones near the midline of the body. This is the area where the pubic bones connect and creates the opening through which a baby passes during birth. So during pregnancy and birth, the ligaments around the pubic symphysis becomes flexible so that the child may pass through without difficulty or complications. So that was the last term for CLO number 1, and we shall proceed with the next reporter.
Good day everyone, I'm Alpha Ashley and I'll be discussing the CLO number 2, which is the importance of Leopold's maneuver, antepartal and postpartal exercise. Let's begin with the Leopold's maneuver. It's important for us to have knowledge about Leopold's maneuver so that we can able to determine the position of a fetus inside the woman's uterus and its possible size upon giving birth. It also helps us to determine the presentation of the fetus. So when we say presentation of the fetus, those are the vertex presentation, shoulder, face, bra, and breech presentation. With the correct assessment on determining the position and presentation of the fetus can indicate whether the delivery is going to be normal, complicated, or whether a cesarean section is necessary. Further, it also allows the examiner to feel for the parts of the fetus. So parts of the fetus are the head, shoulder, limbs, and so on. Then, palpation of the presenting part above the symphysis. Then lastly is to assess and ready for giving birth. Good day. And now, let's proceed to antepartal exercise. By the word antepartal, it means before childbirth. So most exercises are safe to perform during mom's antepartum period, as long as they exercise with caution and they do not overdo it. So by performing the antepartal exercise, they can also exercise the muscles involved upon giving birth. Aside from that, it also helps clients reduce and manage pain. Then it may help prevent the need for a cesarean birth, and lastly, it encourages good posture. Lastly is the postpartal exercise. So number 1 is to reduce edema. We all know edema is a swelling caused by excess fluid trapped in our body's tissue. So during pregnancy, it is normal to experience swelling as the body produces more blood and fluid. It can happen in the hands, face, feet, legs, and ankles. And having extra fluid also helps prepare the pelvic joints and tissue to open for delivery. Swelling or edema may be experienced at any point during pregnancy, but it tends to be noticed around the 5th month and can increase while the mother are in the 3rd trimester. So that is why it is advisable to perform some postpartum exercise to reduce the edema. Second is to prevent uterine prolapse. So what is uterine prolapse? So it is a condition where the internal supports of the uterus become weak over time. So who gets uterine prolapse? It's most likely to happen in women who have had one or more vaginal deliveries and postmenopausal. So in order to prevent uterine prolapse, it's advisable to perform the pelvic floor exercise to promote pelvic floor recovery after childbirth and to lift the pelvic floor muscles. And then third is to regain full bladder control. Fourth is to improve muscle tone, increase blood circulation, mood, and sleep patterns. Then fifth is to prevent deep vein thrombosis, or also known as DVT. So what is DVT? So it refers to blood clots in deep veins of the legs, arms, or pelvis. So pregnancy is a risk factor of the development of deep vein thrombosis. So during pregnancy, factors that increase risk of developing DVT include diabetes, varicose veins, UTI, or also known as urinary tract infection. The risk for DVT increases in the postpartum period. Factors that increase the risk of developing DVT in the postpartum period include cesarean section, hypertension or high blood pressure, postpartum infection, smoking, and so on. So by performing some safe exercise, we can able to prevent the DVT. Then second to the last is to help to reduce postnatal depression, and lastly is to ensure normal sexual satisfaction in future. And I'll be discussing the CLO number 2.
Hello class, it's Morales Rochelle, and we're going to be talking about CLO number 3, discuss the maneuvers in Leopold's. So the first thing we have to do is the procedure. So the first step is to explain the procedure, and then the next is instruct the client to empty her bladder. And the next one would be position the woman supine with knees slightly flexed, and then you would have to place a small pillow or a rolled towel under one side. And after, you would have to wash your hands using warm water, so when you palpate the stomach, your hands are nice and warm. And then the next step would be observe the woman's abdomen for the longest diameter and where the fetal movement is apparent. Next is the first maneuver, which is L1. That is the fundal grip. And the purpose of this is the maneuvers determines whether the fetal head or the breech is in the fundus. And the next would be the procedure, which is where you would have to stand foot of the client and you have to be facing her, and then you have to put both hands flat on her abdomen. And then after, you start to palpate the superior surface of the fundus. And to determine what you're finding is to determine the consistency, shape, and mobility. Next is the second maneuver, L2, the umbilical grip. The purpose of this is to locate the back of the fetus, and the procedure is to face the client and place the palms of each hand on either side of the abdomen, and then once you palpate the sides of the uterus, hold the left on the stationary side of the uterus, and then while the right hand is palpated on the opposite side of the uterus, and you have to have it from top to bottom, and then you would hold your right hand steady and repeat the palpation using the left hand on the left side. And for this, it's to determine the direction of the fetal back where it's facing, where you would have one hand would feel a smooth, hard, resistant surface, which is the back, and then while the opposite side of the number of angular nodulations would be the knees, the elbows, and the fetus, which would be felt. So that'd be the front side. And the third maneuver, L3, is Paulick's grip. So the purpose of this is to determine the part of the fetus at the inlet and its mobility. So for the procedure, you would have to gently grasp the lower portion of the abdomen right above the symphysis pubis between the thumb and the index finger, and you would have to try to press the thumb and the finger together. This determines any kind of movement and whether the part is firm or soft. So for the findings, if it is presenting a part where it's moving upwards, so an examiner's hand can be pressed together, the presenting part is not engaged, so that means it's not firmly settled into the pelvis. And if the part is firm, it is the head. If it's soft, then it is breech. And the last maneuver, the fourth maneuver, L4, is the pelvic grip. So the purpose of this is to determine the fetal attitude and the degree of fetal extension into the pelvis. It should be done only if the fetus is in a cephalic presentation, and the information above the infant's anterior-posterior position may be gained from this final maneuver. And the procedure for this is place the fingers on both sides of the uterus, which is approximately 2 inches above the inguinal ligaments, pressing downward and inward in the direction of the birth canal. This can allow the fingers to be carried downwards. And the findings for this would be the fingers on one hand will slide along the interior contour and it will meet no obstructions, where it's indicating the back of the fetal neck. And the other hand would meet an obstruction an inch or so above the ligament, where this is the fetal brow. The position of the fetal brow touches the hyperextended head, and if the brow is very easily palpated, as it lies just right under the skin, the fetus is probably in a posterior position, and the occupant is pointing towards the woman's back.
Good morning to all. I'm Lieutenant Julia Nicole. I'm going to report and discuss the CLO number 4, which is to list and compare antepartal and postpartal exercises. But before we will start, regular exercises are important to soon-to-be mothers during or after the pregnancy because it can improve their posture and decrease discomforts such as backaches and fatigue. Physical activities may prevent gestational diabetes, relieve stress, and build more stamina needed for labor and delivery. Now, let's proceed with the antepartal exercises. First on the list is diaphragmatic exercise. The steps in doing this exercise is first to lie on a flat surface with your knees bent. Place one hand on your upper chest and the other hand on your belly area. Breathe in slowly through your nose and make sure the hand on your chest should remain still. Then breathe out through your mouth. You do this exercise for 5 to 10 minutes. Diaphragmatic exercise improves your body's ability to tolerate intense exercise and lower the chances of injury or wearing out of muscles. Next is Kegels exercise. Make sure your bladder is empty before and doing this exercise. Then sit or lie on a flat surface. Tighten your pelvic floor muscles for 3 to 5 seconds. The pelvic floor muscles span the bottom of the pelvis and support the pelvic organs, which is the bladder, bowel, and uterus in women. Then relax for about 3 to 5 seconds. Then repeat it for 10 or 3 times a day. Kegels exercise helps strengthen the muscles that support the bladder, uterus, and bowels. Next is pelvic rocking exercise. In this exercise, first you need to place your hands and knees on a flat ground, then tuck your head downward as you inhale, and make a curve with your back in the shape of letter C, and hold it for 6 counts. Then bring your head back up as you exhale, while keeping your back straight and hold it for 6 counts. Do this exercise for 8 times. Performing pelvic rocking exercise can relieve back pain and improve flexibility. They can also get you ready for labor. Next one is bridging. Pregnant mothers need to perform this exercise on a flat ground, then lift their buttocks off the mat while keeping their body straight and hold pose for 5 seconds. Then slowly lower their back on the mat. You must repeat it 10 times. Bridging exercise can strengthen the core muscles and reduces pain. Next is quadruped arm leg. In this exercise, you need to first get down on your hands and knees, then tighten your abdominal muscles and raise one arm and the opposite leg away from you and hold it for about 5 seconds. Then change sides. Do this exercise for 10 times on each side. Quadruped arm leg exercise helps strengthen the muscles needed for labor and delivery. Next is wall slide. This exercise starts with standing with your back against the wall, with feet and shoulder width apart. Slowly bend your knees while keeping your back supported. Then hold that position for a few seconds, then slide back up. You must repeat this exercise 3 to 5 times. Wall slide exercise helps in strengthening the arm muscles, relieves back pain, and improve balance. Next, thoracic extension. You can perform this exercise while sitting in a chair. First, your hands must be behind the head, then gently arc backward and look up toward the ceiling. Repeat it for 10 times. You can perform this exercise several times a day. Thoracic extension exercise can help ease backaches. Next is brisk walking. Walking is great for beginners. For first-time mothers, you can start with a 15-minute walk 3 times a week. Once you've got into a habit of walking regularly, you can build up to faster 30-minute walking sessions for 4 or more times a week. Walking helps toning your muscles, ease your labor, eases constipation, and keeps the body fit. Next is jogging. Mothers must jog at least 20 to 30 minutes a day because it reduces the risk of gestational diabetes, preterm birth, and preeclampsia. It may also improve the baby's brain development. The last antepartum exercise is swimming. Swimming regularly will improve your muscle tone and increase your endurance. It is also good for blood circulation. Mothers should aim for 30 minutes swimming, limiting to 3 to 5 times a week. Now, for postpartum exercises. First on the list is pelvic tilt. In this exercise, first you need to lie down on a firm surface with your knees bent, then start to pull your tummy slowly, and after press your back down flat. Hold it for several seconds and repeat. Pelvic tilt exercise strengthens the abdominal muscles and helps relieve low back pain during pregnancy and labor. Next, elbow to knee lifts. First, you need to bend your knees and put your hand behind your head, then tighten your abdominal muscles. Lift your upper body and reach your right elbow to your left knee. Then slowly lower your upper back to its starting position. You repeat and switch sides for 8 to 10 repetitions. This exercise strengthens the abdominal muscles, arms, and legs. Next is abdominal crunch. First, you need to lie down on your back, then put your feet on the floor. Bend your knees and place your arms across your chest or behind the head. Then contract your abs and inhale. You lift your body as you exhale, then return to its starting position. Abdominal crunch exercise strengthen the abs. Strong abs alleviate pressure on your back and support proper posture. Next, sit-ups. In this exercise, first you lie on your back and bend your knees, keeping your feet against the floor. Put your hands behind the head or across your chest, then lift your body towards your knees as you exhale. Return to its starting position and inhale, and perform it 10 times. Sit-ups improves your overall strength. It can lower the risk of intensity of lower back pain, which is common in pregnancy. Next is reach your toe exercise. In this exercise, first, you stand straight with your feet as wide as your hips, then raise both arms upwards, then slowly bend forward with your arms together, then try to touch your toes as much as possible. Repeat it 10 to 12 times. This exercise makes you more flexible and ease pregnancy aches and pains. Next, stomach tightener exercise. There are exercises that will help tighten the stomach, like bicycle crunches, sit-ups, and planking. Planking strengthens both abs and back and also put less pressure on the spine. This exercise helps restore the stomach area after pregnancy. Next exercise is bicycling on elbows. This exercise strengthens the arms and leg muscles, and it also makes your joints stronger, improves circulation, and ease backaches. Next exercise is leg stretch. For mothers, stretching can offer many benefits. It can help you stay fit, relax, and ease backaches and pains the mother experiences. We have here standing hamstring stretch. This exercise and any leg stretching exercise helps lengthen the muscles and decreases muscle pain. Yoga poses also helps in relieving backaches. Just make sure to not outstretch your arms and legs to prevent further complications. The next one, breathing exercises. We have here 3 breathing exercises, which is abdominal breathing, apical breathing, which contains the movement of the upper chest, and coastal breathing method that uses movements of the ribs to drive both the inhale and the exhale phases of your breath. Practicing it regularly helps cool down the body. Breathing exercises are also a good way to relax, reduce tension, and relieve stress. The last postpartum exercise is pelvic floor exercise. This exercise helps in strengthening the bladder and bowel control and improve recovery from childbirth. So mothers must put in mind that before doing all these exercises, they should know the precautions in order to prevent more complications during or after the pregnancy. They must first perform warm-ups, then drink plenty of fluids to stay hydrated, and they must be careful to avoid intense exercises. Now, let's compare both exercises. In antepartum exercise, it improves blood circulation for the fetus, especially choking, since it improves the baby's brain development. Then it helps prevent excessive weight gain for the mother, prevents low back pain, and enhance physical and psychological preparation for delivery by means of joint stretching and muscle strengthening. In postpartum exercise, it strengthens the pelvic floor muscles to prevent incontinence. It also prevents lower back pain, and some of the exercises speed up restoration of body shape, especially in the stomach area after childbirth. Then it also stimulates blood circulation and enhance appetite, and lastly, maintain vitality and self-confidence. So that's all for the antepartum and postpartum exercises. Thank you and God bless.
Good day, everyone. I am Reese Jody Ha, and I am here to discuss CLO number 5, in which it tasks me to explain the principles involved in Leopold's maneuver, ante, and postnatal exercises. So the principles involved in Leopold's maneuver, ante, and postnatal exercises are the following. First, we have psychology. Explaining to the mother how and why you're performing the Leopold's maneuver will reduce her anxiety and nervousness. You will also be able to gain her cooperation for the procedure. Ensure the client that palpating her abdomen is part of the procedure and will not harm her nor the fetus. You should also emphasize the importance of antenatal and postnatal exercises by letting the mother know of the benefits, as the chances of the mother performing the exercises independently is increased. So in here, in performing the Leopold's maneuver, it is important to reassure the mother, as all she wants is to protect her and her child. Second is anatomy and physiology. Performing the Leopold's maneuver requires that you have adequate knowledge on the different body parts as well as the different processes and changes that will occur during pregnancy. Third is physics. The healthcare provider must warm her hands before performing the Leopold's maneuver to prevent uterine contractions. Fourth is privacy. Before performing the procedure, drape the area properly to provide privacy to the client. Fifth is sociology. Conversing with the mother while performing Leopold's maneuver eases the mother's anxiety. Telling the mother what is found at each step of the procedure will help give her information and will reassure her, especially when the findings are normal. Sixth is safety and security. Before performing antenatal and postnatal exercises, make sure that the mother has consulted her physician so that she will be provided with guidelines based on her medical history. She will also know if she is already allowed to do the postnatal exercises or if she needs more time to heal. The healthcare provider must have the necessary skill in performing the Leopold's maneuver to avoid mishaps such as disturbing the fetus or initiating uterine contractions. Seventh is microbiology. The nurse must have done medical hand washing prior to performing Leopold's maneuver. Gloves may also be worn in case there will be secretions. Eighth is time and energy. In conducting the Leopold's maneuver, the healthcare provider is examining for fetal position and presentation, and aids to keep track of the progress of the fetus and help indicate early on of the type of delivery to be expected, whether normal or complicated.
Good day, ladies and gentlemen. By the way, my name is Mr. Jeremy Ditchos, and I am going to present to you the CLO number 6. Examine the guidelines in Leopold's maneuver, anti and postnatal exercises. Without further ado, let's start. Leopold's maneuver guidelines. Number 1. Leopold maneuver is difficult to perform on obese women because it may be difficult to palpate the fetus inside the womb. Number 2. The palpation can sometimes be uncomfortable for a woman if care is not taken to ensure she is relaxed and adequately positioned. Number 3. To aid with comfort, the nurse should ensure that the pregnant woman has recently emptied her bladder so that during the procedure she will be comfortable and the contour of the fetus is not obscured. Client should lay on her back with shoulder raised slightly on the pillow and her knees drawn up a little, for it to have a proper position and to perform it easily. Next, her abdomen should be uncovered and the individual performing the maneuver should warm their hands prior to palpation. Cold hands can make the patient muscle tense and may lead to discomfort. Lastly, the examiner should take care not to roughly or excessively disturb the fetus, as roughly and excessive procedure may lead to the stress of the baby. Antenatal exercise guidelines. Number 1. The pregnant woman should start slowly and careful not to overexert themselves because it may lead to complication or problem. Number 2. Never exercise to the point of breathlessness. This is a sign that the baby in the pregnant woman's body cannot get the oxygen they need. Number 3. The mother changing weight alters the center of gravity, so putting extra strain on the joint and the muscle, and also in the lower back and the pelvis area, increases the chance of losing balance. Take frequent breaks and drink plenty of fluid during exercise, as it will help to relax your body and replenish the loose fluid. Next, avoid exercising in an extremely hot weather. Doctor and nurses discourage workouts in hot weather because it can lead to heat stress and dehydration. Next, avoid rocky terrain or unstable ground when exercising because ankle sprain and other injury may occur, so it is recommended to exercise in flat level surface. Lastly, include relaxation and stretching before and after exercising because it reduces muscle tension and prevent injuries such as muscle strain. Postnatal exercise guidelines. Number 1. Consult with a doctor or midwife before starting any postnatal exercises for you to be evaluate if you are capable enough in performing postnatal exercise. Number 2. It is important to make sure that your muscles have healed before you do any vigorous abdominal exercises to ensure your safety while doing the procedure. Number 3. Avoid high impact exercise or sports because the ligaments in the joint will be loose for at least 3 to 6 months after delivery. When pain manifests, slow down or stop completely. This is to prevent further complication. And lastly, regular exercise will strengthen the pelvis, but be cautious for exercising too much vigorously too soon. CLO number 7. List the nursing responsibilities before, during, and after performing Leopold's maneuver, anti and postnatal exercises. Before. Number 1. Do medical hand washing. It is necessary to prevent the spread of microorganisms. Number 2. Explain the procedure to the mother and answer any question that she may have. This is to lessen the anxiety or the discomfort that the mother may feel prior to the procedure. Number 3. Instruct the mother to empty her bladder before performing the maneuver so that she will be comfortable and the contour of the fetus is not obscured. Next slide. Number 4, place the mother in dorsal recumbent position, supine with knees flexed to relax the abdominal muscle. Number 5, place a small pillow under the head for comfort. Number 6, drape properly to maintain privacy, because patient privacy is one of the principles of doing the Leopold's maneuver. Number 7, make sure that the hands and the stethoscope are warm. This is to provide comfortability towards the mother. Next slide. During. When palpating, use your palms and not your fingers. Healthcare provider palpates the abdomen with gentle but also deep pressure using the palms of the hand. Number 2. The nurse should stand with the body facing the patient during the first 3 maneuvers and facing the feet of the patient during the final maneuver to have an easily access on doing the procedure and palpating the woman's upper abdomen and the fatal back of the baby. Healthcare provider face the woman's feet as he or she will attempt to locate the fetus brow. Number 3. Observe the mother's reaction for you to be able to assist the feeling of a mother. After. Number 1. Inform the mother about the result of the procedure. Number 2. Evaluate the mother's reaction. Number 3. Give health teaching. This is for them to be educated about the proper way of taking care of the baby as well as the mother. Number 4. Do aftercare. And lastly, number 5. Documentation, because appropriate documentation provide an accurate reflection of nursing assessment. Next, CLO number 8. State comfort position related to antepartal and postpartal exercises. Let's start. Antepartal exercises. For sleep, left side seams position. Sleeping on your left side increase the amount of blood and nutrients that reach the placenta of your baby. For birth, hands and knees position. Takes pressure off the spine, easing back pain, and may help to boost oxygen level. The sitting position. Good for resting. Sitting on the toilet relaxes the perineum, which can help to reduce tearing. Next, birthing ball position. Can help move baby into favorable birthing position, relieves back pressure, and can help encourage dilation and move baby deeper into the pelvis. Next slide. Squatting position. Help open the pelvis, gives baby room to maneuver as he heads towards the birth canal. Next, the upright position. Relieves backache, can make contraction less painful, and encourage the baby to move deeper into the birth canal. Lunging position helps baby rotate or descend, open the pelvis, giving the baby more room. Next, stair climbing position. Open pelvis, allowing the baby to drop farther and push into the cervix and help the baby rotate and get into the better birthing position. Next, squatting birth position decreases the need for a certain delivery tools like forceps or a vacuum and help dilation. Next, reclining can release tension and relax muscle. Next, birthing stool position can help baby move farther down, relieve stress on the back, and increase dilation of the cervix. Next, birthing bar expand the pelvis and uses gravity to push the baby down. Next, kneeling relieves pain of contraction and eases back pressure. Next, postpartal exercises. Example is sociocultural study in sports and physical activity. That is end of my report. Thank you for listening and have a great day, everyone.
Good day, everyone. I am once again Reese Jody Haw, here to discuss CLO number 9, which tasks me to document client responses and outcomes after Leopold's maneuver and ante-postnatal exercises. So in here, we will be tackling terminology, Nagel's rule, McDonald's rule, Long method, and examples. So first, we'll be tackling the terminology. First of which is the LMP, or the last menstrual period. This is the date of the first day of menstruation before a presenting illness or the advent of pregnancy related. An example of which is a client having an LMP of September 25, 2015. The next terminology that we have is the AOG, or the age of gestation. This may be also known as the pregnancy length so far. This may be written in weeks or in months. We have two examples, first of which is having an AOG of 38 weeks or an AOG of 8 months and 3/7 days. The last terminology that we will be taking in is the GTPAL, or the gravida, term, preterm, abortion, and living. The gravida is the number of times the woman has conceived, including the current pregnancy. Term births are the number of times a woman has carried a pregnancy to at least 37 weeks gestation and has delivered. Preterm births are the number of times a woman has delivered before 37 weeks gestation but after 20 weeks gestation. Abortions are the number of times a woman has lost a pregnancy, whether it was by choice or spontaneous. This also means that a number of times a woman had lost a pregnancy before 20 weeks of gestation. Lastly, living children, which also refers to live births. So presented here is an example for GTPAL. Natalie is 38 weeks pregnant. This is her second pregnancy. She delivered a healthy baby boy at 39 weeks with her first pregnancy. What is Natalie's GTPAL? So here we have an answer of G2, T1, P0, A0, and L1. Again, this pertains to Natalie having twice of gravida, 1 of term birth, 0 for preterm births, 0 for abortion, and 1 for living children. The rationale behind this answer is because she had not yet delivered her second baby, but once she does, she will be having G2, T2, P0, A still 0, L2. So as you can observe, the T has increased from 1 to 2. This is because the T again stands for term births, in which currently Natalie is 38 weeks pregnant. She already qualifies for the criteria of term births, having carried at least 37 weeks. And for the living children, this will of course be increased to 2, as again it is expected that she will be delivering her baby. The G will still remain at 2, as this pertains to again the number of given births, including her current pregnancy. Next, we move on to the computation of EDC, showing the correct format on the requirements duty. So here, especially in our requirements duty, we list down the information of the client and the findings of the Leopold's maneuver procedure. So here in the information listed, we list down the date of examination or visit, the name of mother, age of the client, her GTPAL, her AOG, or age of gestation, her LMP, or last menstrual period, and her EDD, or expected delivery date. For the findings, we list down the L1, or the fundal grip, which tackles the fundal height and the fundal content. For the L2, or also known as the umbilical grip, which contains the findings of the fetal back or the position of the fetus and the fetal heart tone and where it was located, as well as the location of the fetal small parts. We also take in the L3 or the pollex grip, which determines what fetal part is lying in the lower abdomen, and the L4, which is also known as the pelvic grip, which determines the degree of fetal extension into the pelvis. Take note, the L4 or the pelvic grip can only be taken if the fetus is in cephalic presentation. After gathering Ms. Lobach's information, we then proceed to compute for the EDC utilizing the Nagel's rule. What is the Nagel's rule? The Nagel's rule is a standard way of calculating for a due date of pregnancy, or also known as the EDD, using the standard computation of subtracting 3 for months, adding 7 for days, and adding 1 for years. On the right side, we have presented the solution on how we have estimated Ms. Lobach's EDD. Utilizing her LMP, which we have gained from the information a while ago, of May 5, 2019, we then list down right below it the standard computation of subtracting 3 for months, adding 7 for days, and adding 1 for years, which will then give us an EDD of 2, 12, and 20, which also translates to February 12, 2020, which can then be said that Ms. Lobach's estimated date of delivery is February 12, 2020. Next, we compute for her AOG utilizing the McDonald's rule. What is the McDonald's rule? It is used to measure the size of the uterus and to assess fetal growth and development during pregnancy. So, in the McDonald's rule, we utilize two formulas depending on how we are looking for the AOG, whether it be in months or in weeks. So for finding the AOG in months or the age of gestation in months, we utilize the formula of fundal height in centimeters, multiplying it by 2, then dividing it by 7. For finding the age of gestation in weeks, we again utilize the fundal height in centimeters, but this time multiplying it by 8, then also dividing it by 7. An example for the McDonald's rule. Here we have presented two examples of finding the AOG in months and in weeks. So again, the formula for finding the age of gestation in months is the fundal height in centimeters, multiplying it by 2, then dividing it by 7. With a given of 32 centimeters from the gathered information a while ago, we have the solution of 32 centimeters multiplied by 2, which gives us 64, then dividing it by 7, which gives us an answer of 8 months and 1 of 7 days. Next, for finding the age of gestation in weeks, utilizing the formula fundal height in centimeters, multiplying it by 8, then dividing it by 7, with the same given of 32 centimeters, we utilize the solution of 32 centimeters, multiplying it by 8, which gives us 256, and after dividing it by 7, we have an answer of 36 weeks and 4 of 7 days. So as you can see, in our answers, we do not utilize decimals. This is because we are expected as student nurses to calculate these manually. Multiplying it or utilizing a calculator for finding the answers may give us a different answer instead of the actual answer. Lastly, we compute for the long method. What is the long method used for? This is used to compute for the age of the fetus. So an example for the long method. So from the information gathered a while ago, we have Ms. Lobach's LMP of May 5, 2019, her EDD of February 12, 2020, which was again taken based on her LMP. And in starting the long method, we first utilize the LMP, which is May 5, and subtract the LMP from the number of days of the month, which in her case was May, and May had 31 days. So here we subtract 31, 5, which gives us 26. So in the long method, we have three separate solutions. First is having the formula for getting the number of days. Then we have a formula for getting the number of weeks. And lastly, we have a formula for getting the number of months. But first, let us move on to the formula for getting the number of days. So right after we have accomplished step 1, we will then list and get the sum of the months and its corresponding number of days from the LMP, leading to the date of the visit of the client. So from step 1, we will list down May 26 and all the following months and its corresponding days that lead up to Ms. Lobach's date of visit, which was January 27. We then add all these values, which gives us 267 days old. Utilizing those values, we then proceed to the formula for getting the number of weeks. For this formula, we basically use the number of days taken and divide it by 7, which represents the number of days in a week. Therefore, 267 days divided to 7 is equal to 38 and 1 of 7 weeks old. Right after that, we proceed to the formula for getting the number of months. We divide the quotient taken from the previous solution by 4, which represents the number of weeks in a month. Therefore, 38 weeks, which was taken from a while ago, will be divided by 4, which gives us an answer of 9 months and 2 weeks old.